Okay, we're going to talk about the PECS block. So typically we want the patient supine, head turned to the opposite side and the arm abducted 90 degrees. When you grab the ultrasound probe, the starting point is typically inferior to the clavicle and medial to the coracoid process. You then want to tilt it down to look into the chest and turn it and go in an inferior lateral direction to find the landmarks. So when you first place the probe, you want to find the axillary artery. You'll see the vein right next to it. And then typically you'll tilt the probe, as I mentioned, so it looks down into the chest, and you'll find the second rib. As you keep scanning laterally, you'll start to see the third rib and then the fourth rib. The goal is to inject local anesthetic in between the pec major and pec minor muscles and pec minor and serratus anterior muscles. And I'll show you some of the landmarks, and the red lines will be where you want to try and inject. Okay, we're going to talk about the suprascapular block next. Typically for beginners like me, you want the patient to be sitting with the head down, but they can also be in a lateral position or prone. For the ultrasound probe, the starting point is usually superior to the scapula spine, and you want to start medially and scan laterally. So when you first scan it, you can adjust the depth of the ultrasound as needed. You'll see the trapezius muscle pretty prominently. At the bottom, you'll sometimes be able to see the superior transverse scapular ligament. You want to inject underneath that red line into the scapular notch. All right, for the rectus spinae and the paravertebral block, the positions are very similar. They'll be sitting with the head down. Again, they can also be lateral prone. The starting point for both will be at the desired transverse process that you're trying to block, lateral to the spinous process. You can typically scan medial to lateral or lateral to medial as long as you can tell which one's the rib and which one's the transverse process. For the paravertebral block, you start at the same spot, but then you'll be moving the bottom of the probe more laterally, like that. So we'll talk specifically about the rectus spinae anatomy. As I mentioned, you'll either see transverse process or rib. Ribs are typically more circular looking, like this. Transverse process is slightly more squarish or flattened out at the top. Can be difficult to see, but you do want to inject underneath the red line. You'll see these muscles. Just FYI, the rhomboid major muscle will not be present underneath T6. For the paravertebral ultrasound anatomy, as I mentioned, you find the transverse process, and as you move the bottom of the probe out more laterally, your goal is to see the transverse process at the top part of the probe and then the rib on the bottom part. And in between that, you'll find the paravertebral space underneath the superior costal transverse ligament. All right, so next we're going to talk about the rectus sheath block as well as the subcostal and lateral tap blocks. Typically, the patient will be supine, and you start the probe midline of the abdomen and start to move laterally. For the subcostal tap block, you want to place the probe parallel and adjacent to the costal margin. Now, obviously, for the lateral tap block, you go more laterally. For the rectus sheath block, I typically like to start in the midline of the abdomen to be able to find the linea alba. Connects the two rectus abdominis muscles. As you scan more laterally, you'll see the muscle be more defined. Typically inject local anesthetic underneath the rectus abdominis muscle, and be careful because the bowels are literally right underneath there. For the subcostal tap block, again, I mentioned we place the probe parallel and adjacent to the costal margin, and as you scan more laterally, you'll start to see the internal oblique muscle start to form. As you see the rectus abdominis muscle start to taper off, you'll see the three muscles more apparent there, and you want to inject above the transverse abdominis muscle. And then for the lateral tap block, as you move more laterally, you'll see the three muscle layers even more defined. And again, you want to still aim between the internal oblique muscle and the transversus abdominis muscle. For the quadratus lumborum block, typically the patient will be in a lateral decubitus position, but I've also seen it with the patient supine. You want to find the mid-axillary line and place the probe between the inferior costal margin and the superior iliac crest while scanning laterally. What's a good tip is that you try and find the external oblique, internal oblique, and transversus valgus muscles. Follow it laterally until it kind of tapers off into a kind of looks like a fascia layer. And it'll usually point to the quadratus lumborum muscle. And sometimes you'll even see a thumb sign, which is the transverse process shadow. Those 3 circles are where you can typically inject local anesthetic.
Come see us at Maverick.
For sure.